Hello future nurses, welcome back to Easy Nurse, where nursing education made easy. So today we are Easy Nurse here for the live, that is midwifery and gynecological nursing for the third year GNM. So let's start about today's session. Okay, so first we are going to see regarding the signs of the pregnancy. So what is the meaning of pregnancy? Pregnancy is a journey which is started after the fertilization and when this conception product will be replaced in the uterus and the fetus processing journey is going to be started. So that journey is called as a pregnancy, and it's all about 9 months journey, right? So what are the signs means for which you can able to understand that mother or that particular woman is going to be pregnant? Okay, so first is the possible sign. So under the possible sign, amenorrhea. Amenorrhea is nothing but like a stop of the menstruation cycle. So nearly 4 weeks you can able to understand. Next, the morning sickness, that is 4 to 14 weeks. Then bladder irritation 6 to 12 weeks. Quickening, or the quickening is nothing but the mother will be feeling first time the fetal movement. So that is called quickening, and you can feel it around 16 to 20 weeks. Next is the early breast enlargement. It is showing around 3 to 4 weeks, and then fatigue. Next, come to the probable sign. So under this probable sign, first is the presence of HCG hormone in the circulation system or the blood nearly 9 to 10 days or the 14 days. So that is one of the main indicator of the pregnancy. So when they are going for the pregnancy test with the urine kit, so mainly they are showing this the positive or negative with the presence of the HCG hormone level in our circulation system. Next is the Hager sign. Hager sign is nothing but like softening of the cervix or the lower uterine segment. Next is the Chadwick sign. Chadwick sign is nothing but like bluish discolorations of the cervix vulva as well as the vaginal wall. Next one is the Osiander sign. So Osiander sign is nothing but palpable pulsation you can feel at the edge of the vagina. Next one is the ballotment of the fetus. Ballotment of the fetus is nothing but like you can feel it's some techniques through which you can feel the floatment of the uterus. Means if any product, if it is present inside of the uterus, means you can feel it. So that is called ballotment. Next is the pigmentation of the skin, means darkening of the skin color. Then Braxton Hicks contraction is also known as a false labor pain. Okay, so Braxton Hicks contraction you can see during the early pregnancy phase. So what is happened from the lower part, from the back side to front side, you can feel this pain, but it is not effective for the cervical dilatation as well as the descending down of the fetus. Okay, now come to the positive sign. So for the positive sign, like ultrasonography for visualization of the uterine sac, whether any viable product of conception is present or not. Next, fetal heart sound by the Doppler at around 11 to 12 weeks. Fetal movement around 22 weeks. Visualization of the fetus in X-ray at the 16 weeks. Now come to the first trimester period. So what are the symptoms you can see? That is subjective symptoms. Okay, so in the first trimester, first and one of the most important symptoms, that is amenorrhea. So it means missing of the period. So it will be held up to the 3 months in a menstruation women during the pregnancy unless otherwise proved. Next one is the morning sickness. Morning sickness is nothing but it includes the nausea, vomiting, loss of appetite without vomiting or with vomiting, which is appears around the 2nd month of pregnancy. So when the mother is getting up or rising up in the early morning from the bed, so that then they will feel dizziness and they will feel the vertigo as well as the nausea, or sometimes vomiting is happen or the symptoms is present without vomiting. Okay, so the intensity it is varies nausea on rising from bed to loss of appetite, even vomiting. Next one is frequency of the micturations is nothing but like unable to hold the urine. It's a very common symptoms during the 8 to 12 weeks of the pregnancy, because due to the enlargement of the uterus, what is happen, it is creating the negative pressure on the bladder. So the bladder muscle is going to be very loose, so the mother can't hold the urine properly. So that's why they have to go for the urination urgently and as well as frequently. So that is called frequency of the micturation. So it's mainly due to resting the bulky uterus of the fundus of the bladder, which is become a anteverted positions of the uterus. Next one is the breast discomfort. So what is happened, the breast is becoming very enlarged around 3 to 4 weeks of the pregnancy. At that time it's become very fullness as well as the pricking sensation the mother is feeling which is evident as early as 6 to 8 week of the pregnancy, especially in the primigravida mother. Next come to the probable sign. So for the probable sign, first is breast changes. Nearly 6th week, what is happened? Developing the glands and duct, as well as nearly 8 weeks, it is bluish surface you can see, means veins become visible. Then around 8 to 12 weeks, the Montgomery tubercles become more prominent on the areola, and then as well as sebaceous gland, which is secrete the sebum, keeps the nipple darkened. Next one is the pelvic changes. First is the Jacquemus sign or Chadwick sign. So what is this? It's nothing but bluish discolorations of the vestibule as well as the anterior vaginal wall, which should be visible nearly the 8th week of the pregnancy. So that is called Jacquemus sign and Chadwick sign. So you have to remember those signs very promptly, okay, because during this viva question they ask you, as well as during the exam, like around 2 marks on 1 marks, they will frequently ask you Jacquemus sign, Goodall sign, Chadwick sign, Bulba sign, etc. So this is the image. So now come to the Occipital sign. Occipital sign is nothing but bluish discolorations of the vaginal wall, and the walls become very soft. Next one is the cervical sign, when the cervix becomes soft nearly the 6th week, particularly when it is happened nearly the 6th week, so that time is called as a cervical sign. It's also known as a Goodall sign, okay. But same like vaginal wall become very soft as well as bluish discoloration, so that time is called as a Occipital sign. So differentiation you have to understand. Now come to the investigation. So what is the investigation of the probable sign? So first is pregnancy test or immunological test. So mainly this test should be done with the presence of HCG in the maternal serum and urine, okay. So what are the things test is going to be used? That is immunoassay without radioisotope. So what is happened under this agglutinin inhibition test? So what is happened? It is confirming the pregnancy through the presence of the agglutination. If the agglutination is present, means pregnancy is negative. If agglutination is absent, means pregnancy is positive, okay. So see the pregnant, for the pregnant cases, what is happened? Urine which is contain HCG, along with this HCG antigen they are taking in the lab, okay. So they are mixing this together, and after that neutralization of antibody plus HCG coated latex particle, means a neutralization of the antibody from this particular content is going to be separated, and then HCG coated latex particles is also going to be separated. So no visible agglutination, so that's why it's informed that pregnancy is positive. For the non-pregnant case, what is happened? Urine which is no HCG content, along with this HCG antigen they are taking in the lab. After mixing, what is happening? HCG antibody not neutralized because there is no HCG, so obviously neutralization should not be happen, and HCG coated latex particles is going to be separated. So agglutination is occurring in this the cases, so that's why it's indicate the pregnancy is negative, okay. So that is the mainly agglutination inhibition test by using the immunoassay without isotope, and that is a pregnancy test or immunological test. Now come to the through ultrasonography. So what is happened? Spherical gestational sac they are going to assess around the 5th week of the pregnancy. Fetal pole they are assessed around the 6th week. Visualization of the fetal heart motion they are finding around the 7th week. Biparatal diameter of the fetal skull from 2.1 centimeter nearly 12th weeks they can assess. Fetal heart sound around 10th week they can assess. Gestational sac around 4th week they can assess. Yolk sac they can assess around the 5th week, and fetal pole they can assess nearly the 5th week, okay. So this is the ultrasonography cases based on the gestational age period and the progressions of the like pregnancy. Through the ultrasonography we can assess whether pregnancy is positive or negative. So now come to the second trimester. So during the second trimester, first we have to know the duration. So duration is 13 to 28 weeks. So what is the clinical symptoms? Nausea, vomiting, frequency of micturition which is usually subside. Next is the quickening and progressive enlargement of the lower abdomen for the growing fetus. Now come to the general examination. So for the general examination, first is chloasma. Chloasma is nothing but pigmentation over the forehead and then the cheek which is appear nearly 24th week. Next, breast. Formation of the secondary areola of the pigmentation which is around the primary areola in breast which is appears from the 20th week. Now come to the abdominal examination. So first is inspection. So for the inspection, linea nigra which is a line of pigmentations in the middle of the abdomen which is appears from the symphysis pubis to the xiphoid sternum process. So that is called inspection. So for the abdomen, what is the palpation? So for the palpation, like gravid uterus means in uterus already this viable product of conception is present. So that is called gravid uterus or the pregnancy mother uterus. Okay. So for them you can feel it in the midline as a soft as well as elastic lump which is arising from the pelvis fundal height, and it's going to be increasing progressively an enlargement of the uterus. So 12th week you can feel the fundus level nearly the symphysis pubis. 14th week you can feel 2.5 centimeter above symphysis pubis. 16th week you can feel the fundus around the 5 centimeter above symphysis pubis. 20th week you can find nearly 2.5 centimeter above umbilicus. 24th week you can feel at the level of umbilicus, and 28th week you can feel lower 1/3 of the distance from umbilicus and ensiform cartilage. As well as Braxton Hicks contraction also you can feel during the palpation, external ballotment and active fetal movement. Now come to the investigation. So what is the investigation? Through the ultrasonography, it should be done nearly 12 to 20 weeks. Next, detection of the fetal anomalies means fetal congenital anomalies or fetal malpresentation, malposition or any kind of limbs or any other problem is if it is present means we can find it. Fetal viability determination as well as a fetal heart rate also we can assess through the ultrasonography. Now come to the radiography. So under this X-ray which is show the fetal skeletal shadows which is visible nearly around the 16th week. So now come to the third trimester. So for the third trimester, what is the subjective symptoms? First is amenorrhea, 8 to 10 months. Then enlargement of the abdomen, lightening. Lightening is nothing but when the mother is coming under the third trimester period. So what is happening? Suddenly the mother will feel the fetus is rotating by individually, and the fetus head is going to engage inside of the mother's pelvis. So that feeling is called as a lightening, as well as a fetal movement means quickening and then pressure symptoms. Now come to the sign. What are the signs? General sign like colasma on the face, edema on dorsum of the feet or ankle. Now come to the obstetric sign. So under this inspection, first is stria gravida. So that is called colasma and that is the edema formation. So first is stria gravida. Stria gravida is nothing but like stretch mark you can see nearly the abdominal tissue as well as subcutaneous fat because excessive fat accumulation. Next is the linea albicans. Linea albicans is nothing but for the stria gravida, for the bronch kind of pigmented people, they are having this kind of thing. So that is called lineal albicans. Next, uterine size becomes changed to the cylindrical to the spherical around the 36th week of the pregnancy because of the development of the fetus. Now come to the palpation. So for the palpation, what is happened? Height of the uterus you can usually lies on one side of the midline, which the uterus turns into the right after the 20 week. So around the 28th week, the fundus which is reaches lower 1/3 distance between umbilicus and from the cartilage. Around the 38th week, fundus you can occupies lower 2/3 of the later space. 36th week, fundus reaches near to the subcostal arch, and nearly the 40th week, fundus reaches up to the xiphoid sternum. As well as Braxton Hicks contraction, fetal movement which you can feel easily, as well as fetal part also you can palpate while you are going for the fundal grip. Okay. Next is the uterine sophule as well as a fetal sophule. Now come to the vaginal examination. So under this vaginal examination, we have to see like cervix become very soft and moist. As example, the Goodell sign, a Chadwick sign, you can see the cervix remains very directed backward as well as when it comes in line with the vagina. Now come to the antenatal care. So what do you mean by the antenatal care? Means before the delivery, from the time of conception to till the delivery period, this period is known as the antenatal period. So in this time, systemic supervision, examination as well as advice of a woman during pregnancy is called as a antenatal care. So the supervision which should be of a regular as well as a periodic in nature. Okay. So this care which should be started from the beginning of pregnancy and end of the delivery of the placenta. So antenatal care, it's comprised of the two factors. First is careful history taking as well as examination, general as well as obstetrical. So during this antenatal period, if we are finding any kind of the abnormalities or any kind of the complication, so based on that we can provide the treatment. Next is advice which should be given to the pregnant woman. Now come to the aims of antenatal care. First is the screening high risk cases, as example gestational diabetes mellitus or the gestational hypertension or any other other kind of the diseases. If it is present means if we can find it early means we can treat it. Next one is the prevent to detect or treat any kind of any complication. Ensure the continued medical checkup based on the doctor's recommendation as well as the antenatal visit period as well as immunization period. Next, provide the health education to the mother, discuss about the procedure of the delivery and provide the motivation for the couple, for especially for the early parenthood. Okay, because sometimes what is happen after conception, after giving the birth, they can't accept this parenthood phase because they don't have that much idea what is the parenthood phase, what should be the responsibility. So for this they need the proper counseling or the guidance, so that is also under antenatal care. Now come to the objectives of the antenatal care. Obviously prevention, early detection and then treatment of pregnancy related complication, prevention, early detection and treatment of the medical disorder, like if the mother is having previous diabetes mellitus or previous hypertension or any kind of previous renal dysfunction, so that time we can treat it very early. Next is detection of malposition as well as a malpresentation, like occipital position is a normal, right? Along apart from this, if it is like limb presentation or face presentation, eyebrow presentation, buttocks presentation, breast presentation, so that time based on the presentation or position we have to do the proper procedure, means delivery procedure, right? So that's why it's also one of the most important objective. Next, instruct the pregnant woman about the diet, hygiene and warning symptoms. When we are going for the antenatal visit or antenatal instruction, so that time obviously we have to mention, like before conceiving the pregnancy, how much was the mother's weight. After conceiving the pregnancy till the delivery period, the mother has to increase minimum 10 to 11 kg, okay, within 9 months. So for that only the baby will be the healthy, because if the mother will consuming the healthy food and diet everything, so obviously the baby is also getting the healthy nutrients from the mother's body, right? So that we have to mention, as well as the warning symptoms, especially the bleeding. Bleeding is one of the most important warning symptoms. Sometimes what is happened, except the causes of miscarriage also sometimes bleeding is coming. Okay, so for that what should be the management, how to be treated, everything we have to explain. Next, come to the laboratory investigation, means blood culture, stool culture, urine culture, everything we have to assess, especially for the urine, that is glucose, and then the albumin level we have to check. Okay, now come to the antenatal visit. So first there are total third visit is there. Okay, 3 visit. First visit nearly 20th week as soon as the pregnancy known, then the second visit should be around 32nd week, and third visit should be around 36th week. So first visit, what is the main objective of the first visit, should not be referred beyond the second missed period. Means if first period is missed, then only we have to consult with the doctor. We can't wait up to the second missed period. If we wait up to the second missed period but still we can't go beyond of this. Next, screening the high risk pregnancy at the early phase, like cancer or any kind of fetal anomalies or fetal abnormalities, or the mother's like uterus problem or the structure problem, obstetrical, gynecological or anatomical, whatever, as well as any kind of presence of communicable or uncommunicable disease or the chromosomal disorder like thalassemia or anything, that we have to screen it properly as soon as possible. Next, provide the health education which should be according to the gestational age. Based on the gestational age, what should be the pregnancy process, what are the things the mother have to consume, what are the things the mother can't have to consume, how the mothers have to do the regular exercise, why it's important, when they have to go for the proper sleep, how many hours they need to sleep, everything, each and everything point we have to explain. Now come to the procedure. So first is history collection, obviously general information about the mother, history of the present history, like LMP means last menstrual period, as well as EDD means expected date of delivery. If we know the LMP, obviously we can calculate the expected date of delivery. Then menstrual cycle regularity, history of oral contraceptive pills use, as well as booking visit. Next one is the post-obstetrical history, medical or surgical history, family history, as well as the personal history also we have to check. Next, previous gynecological history, if the mother is having previous any kind of the PCOD or ovarian cancer or ovarian cyst or any kind of the disease, that also we have to mention it. So now come to the Nagl's rules. What do you mean by the Nagl's rules? It's nothing but it's a standard way of the calculating of the expected date of delivery by the LMP or the last menstrual period. Okay, So when this assuming gestational age up to 80 days at the childbirth. So EDT, which is mainly based on the calculated based on the LMP, how you have to calculate, you have to add the 7 days with the date, and then you have to subtract the 3 months or the 9 months from the month. So see the example, LMP is 22/06/21. So what should be the EDD? With the 22 you have to add the plus 7, right? So it should come 29. Then from the 06 you have to subtract the 3 months, right? So it's come as a 03, means March month. So March month and then 2022. So this is the LMP and EDD process. Now come to the physical examination. So general examination, vital signs, height, weight of the mother, head to foot assessment, like any ascites is there or not, any scare present is there or not, any kind of allergy is present for the any kind of medicine or not, that we have to assess. Then obstetrical examination, especially the breast, means lump, then any kind of areola, then nipple size, as well as the firmness, tenderness or the feelingness is present or not, that we have to check. Next, abdominal as well as a vaginal examination, means cervical assessment, as well as a bluish discoloration is present or not, if any kind of the anatomical malformation is present or not, everything we have to check. Now come to the routine investigation. Under this, the blood culture test, urine examination. So under this, the blood culture, LFT, RFT, everything we have to check, and in the urine mainly the glucose and then the albumin level we have to check for it. Next is the special investigation, serological testing, like if the mother is having any kind of the HIV or any kind of the sexual transmitted disease or not, if it is present or not, that we have to check through the serological testing, as well as the viral load. If it is present, means how much is the viral load for that mother, whether it is safe for delivery or not, etc. EVC means ultrasonography, maternal serum alpha phytoprotein level we have to check to detect the any kind of the cancer like risk. Okay, so that is the physical examination. Now come to the subsequent visit. So for this, according to the WHO or World Health Organization, at least the 4 visit is needed and must be done from the first to second trimester around 16 weeks, and second visit should be done between the 24 to 28 weeks, and third visit around 32 weeks, fourth visit around 36th week. Okay, so what is the objective? Assess the fetal well-being, fetal heart rate, fetal anomalies, if it is present or not, everything we have to check. Then lie, either longitudinal lie or the like cephalic lie, what is the lie, that we have to check whether this lie is suitable for the normal vaginal delivery or not. Then presentation, either cephalic, then as well as occipital or face presentation, limb presentation, buttocks presentation, etc. Then position as well as a number of the fetus. Next, the screening the high risk cases for the mother. Next one is organize the special antenatal visit for the cardiac disease as well as the DM patient, means gestational diabetes mellitus, or for the gestational hypertension patient we have to organize a special treatment. Select the time for the USG. Amniocentesis. Amniocentesis is nothing but if amniotic fluid is having any kind of the virus or infection, means the fetal will be affected, right? So for that, what we have to do, we have to take some amount of the amniotic fluid from the mother's abdomen through syringe, and we have to go for the send it for the laboratory technology and the testing to check whether if it whether the virus is present or not. Okay, so that is called amniocentesis as well as chronic villus sampling technique. Now come to the history collections for this. First, appearance of the new complaints. If the mother is having any kind of the new complication, that also we have to check. Next, quickening and then lightening. Then come to the physical examination for the first trimester. Main and first important physical examination, that is the fundus height level checking. Second trimester, external ballotment, fetal movement, palpation of the fetal part. In the third trimester, we have to identify the lie, presentation, position, growth, pattern, engagement, abdominal girth and fundal height. Now come to the abdominal examination. So uncover the patient's abdomen only by covering the other parts of the female body with a draw sheet from the ziphered sternum to the pubic hairline, which is mainly ensuring the adequate exposure, which is allowing the patient modesty. So what is the inspection? We have to see the presence of abdominal mass, which is arising the pelvic consistency with the pregnancy, scarce pigmentation or other the skin lesions, which is noted as well as fetal movement which can be observed. Now come to the palpation. So for the palpation, fundal grip or the first maneuver, so that is called the fundal grip. Okay, that is lateral or umbilical grip or second maneuver, then Paulic grip or the third maneuver, and pelvic grip or the fourth maneuver. So now we will discuss one by one maneuver. First come to the fundal grip or the first maneuver. So what is this? We have to do the palpations which can be done by using the fingertips facing towards the omen face. Okay, we have to round the hard movement. Movable part, if we find any movable part around the fundus level, so it means that is presence of head, and it's a irregular bulky which is less firm if we can feel during the palpation, which is indicate the breech, as well as neither of the above. If you can't feel, it means the fetus position is transverse lie position. Now come to the umbilical grip or the second maneuver. So what we have to do, we have to place our both hands surrounding of the uterus. We have to apply pressure through the one hand and move the fetus to the other hand side, and we have to palpate the parts through the other hand when we have to facing towards the mother's face, and the smooth curved and then hard resistant surface which is indicate the spine, and the small knob irregular parts of the modus which is indicate the limbs. Okay, now come to the Paulic group or the third maneuver. So what is this? Woman which should be placed in the knee bent towards the woman facing face, and we have to grab the portions of the lower abdominal above the symphysis pubis which is between the thumb and middle fingers of our hand. So what is the observation? If the fetal head is above the brim, it will be readily movable and ballotable. If it is not ballotable, it indicates the head is already engaged. Now come to the pelvic grip or the fourth maneuver. So nurses, they have to face towards the mother's feet, and we have to place our hands on the side of the uterus with the palm of hands just below the level of the umbilicus and directed towards the symphysis pubis. So this, if your fingers is coming towards and joint, so it means the conjugate. So it means the divergent, and if the fingers are not attached, it's like a opening, so it means the convergent. So divergent is nothing but like head is engaged, convergent means not engaged. Okay, so this measurement which is determine the engagement of the head in the pelvis. Now come to the symphysis pubical height or the symphysial fundal height. So measurement the distance between the fundus as well as the symphysis pubis, which is mainly accurate after the 20th week of the gestation. So measuring the symphysis fundal height in the centimeter in each the antenatal visit from the 24 weeks of the gestation. So now come to the vaginal examination. We have to assess the fetal station, either -1, +2, 0, +1, +2, +3 based on the fetal position, as well as based on the diameters of the fetal based on the diameters of the mother's like pelvis. Okay, next we have to ascertain whether there are any tumors or abnormalities if it is present in the genital tract or not. We have to decide whether the pregnancy is intrauterine or extrauterine, or also we have to identify the fetal presentation, position, lie, attitude and denominator. Okay, so now come to the minor disorders during pregnancy. So for the gastrointestinal system, mainly disorder is nausea, vomiting, heartburn and constipation. For the musculoskeletal system, backache and then muscle ache. Next come to the cardiovascular system, that is the supine hypotension as well as varicose vein and then edemas. For the respiratory system, dyspnea and nasal stuffiness. For the reproductive system, leukorrhea, Braxton Hicks contraction, and for the urinary system, urinary frequency urgency as well as the stress incontinence. So now come to the discomfort of the pregnancy as well as intervention. One by one we have to discuss. So first come to the gastrointestinal system. First is nausea and vomiting. So what is happen? It is most important discomfort during the early pregnancy due to the high level of HCG and then progesterone level in the circulation system. So nausea and vomiting which is usually subside at the end of the 12th week of the pregnancy. Okay, so what is the intervention? We eating the dry crackers, avoiding brushing teeth immediately after rising, eating the small frequent meal, avoiding the fried food or spicy food. Now come to the heartburn. So heartburn is nothing but it's a burning sensation in the epigastric region which is result the relaxation of the cardiac sphincter as well as decrease the tone and then mobility of the smooth muscle. So what is the intervention? Eat frequently small meals, eat slowly, avoid the fatty as well as the gas forming foods, maintain the good posture, avoid the lie down after eating and performing the tailor sitting exercise which is mainly helpful to tightening the pelvic floor muscles. Now come to the constipation. constipation, which is usually occurs second and third trimester, and then gastrointestinal tract motility is also going to slow down due to increase the progesterone level, which is resulting in the increase the reabsorption of the water and drying of the stool. So what is the intervention? Eating the high fiber diet, avoid the laxative or enemas without first consultation of the doctor, drink at least 6 glasses of water in a day, do moderate exercise, maintain the regular schedule of the bowel movement. Now come to the hemorrhoids. Hemorrhoids is nothing but which is occurs usually near the second and third trimester, which is mainly increased venous pressure and then constipation. So what is the intervention? Soaking in a warm sea bath, sitting in a soft pillow, eating the high fiber diet to prevent constipation, apply the ointment suppository as prescribed by the physician, and increase the physical exercise, especially the walking. Now come to the leukorrhea or increase the vaginal discharge. So it's usually mainly under the reproductive system. Okay, so what is happened? It occurs from the first to third trimester. It's a white as well as a yellowish discolorations of the mucus discharge from the cervical canal as well as vagina, which is caused by the hormonal stimulation of the cervix, and it's also may lead to the pruritus. Pruritus is nothing but severe itching and burning on the urination, which is foul odor from the discharge or edema of the vulva. What is the intervention? Proper maintaining the personal hygiene, wearing the cotton underwear, avoiding douching, and clean the vulva at least once in a day with a soap and water and to dry thoroughly. Now come to the Braxton Hicks contraction, which is a mild, intermittent, usually painless uterine contraction, and this contraction in preparation for the work of the labor. Okay, so get plenty of the rest, avoid douching, practice the breathing technique when contractions are bothersome. Now come to the urinary system. For the urinary system, first is urinary frequency and urgency, which is caused by the vascular engorgement as well as altered the bladder function, which is caused by the increase in hormone as well as putting the negative pressure on the bladder due to the progression of the uterine size, and this is due to enlarging the uterus, which is a fetus presenting part, and it's usually occur near the first and second trimester period. What are the intervention? Limiting the fluid intake in the evening, voiding at regular intervals, sleeping in one side at the night, and wearing the perineal pad if necessary. Now come to the stress incontinence, which is occurs later in the pregnancy and caused by the enlargement of the uterus and pressure on the pressing part of the bladder. So the Kegel exercise is an alternative tightening and then relaxation muscle of the perineum, so which is mainly encourage the mother to wear the perineal pad and informing the patients to notify the physician so that the rupture of the membranes can be ruled out. Now come to the respiratory system. So for the respiratory system, first is shortness of the breath or dyspnea. So it is caused by the limited expansion of the diaphragm, which is mainly happened by the enlarging uterus, and it's also may be very troublesome in the last time of the pregnancy period, and it's occur near the second and third trimester. So what is the intervention? Sleep on the additional pillow, maintain the good posture, avoid the overreacting as well as smoking, limit the activity before becoming dyspnea, decrease the anxiety by concentrating on the slow deep down breath and sleeping with the head elevated on the side and performing the tailor sitting exercise. Now come to the nasal stiffness, which is occur nearly the first trimester to third trimester, which result from the estrogen causes the swelling of the nasal tissue as well as the dryness, and it's caused by increase of vascularization due to increase in the hormone. Avoiding the use of the nasal spray or the antihistamine, encourage the use of humidifier. Now come to the cardiovascular system. So for that syncope means supine hypotension, which is caused by the pressure of the gravid uterus on the ascending vena cava vein omen in the supine position, which is decrease the return blood flow. So that's why blood pressure is also going to decrease. So what are the symptoms? Nausea, feels faint, decreased blood pressure. It's usually occur first to third trimester. What are the interventions? Sitting with the feet elevated, changing the position slowly, changing position with the lateral recommend to the relieve the pressure of uterus as well as use of the sideline position. Now come to the varicose vein. So varicose vein is nothing but it's an enlargement of the lumen of the vein due to thinning and stretching of the walls, and it's caused by the relaxation of smooth muscle walls of the vein, which is due to the increased hormone, and it also involves the vein of lower extremities, external genitalia, pelvis and perineal area. Wear the supporting shoe, elevating the feet when sitting, avoid the leg crossing, get adequate rest, avoid obesity, avoid constructive clothing, perform the moderate exercise, avoid the constipation and bearing down, avoid the lengthy sittings or the standing. So now come to the edema. So edema, which is usually occurs nearly the second trimester of the pregnancy, which is result from the vasodilations and then increase the venous pressure below the uterus, and it's also going to cause due to the reduced blood circulation into the lower extremities as the gravid uterus, which is puts the negative pressure on the large vessels. So what are the interventions? Elevating the legs at least twice a day, sleeping on the left lying positions, avoiding the sitting or standing in one position for a longer time, drink at least 8 glasses of water, diuretics should be contraindicated, maintain the good postures and wearing a supportive stocking. Now come to the headache, which is occur nearly the second and third trimester of the pregnancy, which result from changes in the blood volume as well as the vascular tone. So what are the interventions? Changing the position slowly, take the adequate sleep, use the acetaminophen only if the prescription is there, and eating only the small snacks. Now come to the musculoskeletal system. First is the backache, which is usually occurs in second and third trimester of the pregnancy, caused by the pressure on the sacroiliac joint, which is due to the increased hormone. And what are the intervention? Wearing the low heel shoes, encouraged to take rest, which is mainly performing the pelvic rocking and abdominal breathing exercise. Also we have to intervene, advise the practice the good posture and good body mechanics. Now come to the muscle cramps. It usually occurs nearly the second and third trimester of the pregnancy, which is result from the altered calcium phosphorus balance and the pressure on the uterus or the nerves. What are the intervention? Getting the regular exercise, dorsiflexing the foot of the affecting leg, avoid the drinking more than 1 quart of the milk in a day, take the prescribed vitamin B and D, patient should lie on her back and extend the effective lung. Now come to the investigation. So under this the investigation, first is ultrasonography. So through the ultrasonography, how we are going to check? First one is the estimation of the fetal weight, and it should be happen nearly the 14 to 26 weeks of the pregnancy period. We can check the proper weight of the fetus through the ultrasonography. Assessment of the amniotic fluid volume to assess whether it is a excessive amount of the fluid is present or less amount of the fluid is present. Okay, hypoglycemia or oligohydramnios. Okay, now come to the assessment of the placenta, whether the placental lobe, how many lobes are present, whether the umbilical cord is attached on the center of the placenta or not, everything we have to check. Okay, and last one is gestational sac identification as well as the identification of the fetal anomalies. Okay, so mainly in this session I discussed regarding the unit 4. I hope you all understood my session. Again we'll meet in next session. Till that, keep learning and stay tuned with the Easy Nurse. Thank you.